morning. My name is Janie Peacock. I'm a master's student at Liberty University. I'm studying public health with a concentration in nutrition. Today I'd like to discuss my 2015 practicum, in which I was afforded the opportunity to perform at the Plano, Texas Environmental Health Department. Next slide. So first we're going to discuss some FDA food code background and some of its purpose, which will open to the aim of this project of the 9 program standards. We're going to discuss Standard 5 and 5 auditable areas. We'll then talk about some of the methods, that design and its overview, and then some of the recommendations that I had and the results of the project. And then we'll discuss some of the things that I've learned from the project as well. Next slide. So the FDA was established in 1998. It established food code standards in an effort to provide uniformity to the regulatory agencies that guide and inspect food retail. The standards that they developed were called the Voluntary National Retail Food Regulatory Program Standards, and they consist of 9 standards. This project covered only Standard 5. Standard 5 was known as the Foodborne Illness Outbreak Standard. It was called the Foodborne Illness and Food Defense Preparedness and Response Standard. So the 5 auditable areas that we're going to discuss more in detail start with the risk factors involved in the data analyzed, as well as some corrective action plans that were developed. Next, we're going to talk about some of the same food establishments that were implicated, as well as the same establishment types. We'll talk about the implicated food types, and then lastly, the food process. Next slide. So the methods overview and design consisted of a total of 56 consumer complaints that were received by the Public Health Department from 1 October 2014 to 31 September 2015. These complaints were received by the Administrative Office of the Health Department, and then each complaint was provided to an inspector, in which the inspector had 24 hours to inspect that food establishment. As the intern, I was provided each of the complaints and the information that was given, those data sheets, as well as the inspector's results. The next slides will talk about each of the 5 auditable areas and the analysis driven. Next slide. So the first auditable area consisted of the risk factors found within the complaints of the food establishments, and these translate to the food inspectors as food code violations. There were 69 violations total, and the most observed is something we've seen in research for decades: potentially hazardous food temperature abuse. That was seen at a frequency of 16. Dirty utensils and equipment or debris on food contact surfaces was identified with a frequency of 10. And then not having a certified manager on duty was at a frequency of 6. And this is not just having the required documentation at the time of the inspections, actually physically having that certified manager on duty. The employees were observed drinking and eating in the food prep areas and in the kitchen, and that was observed at a frequency of 4. And then the washing machines not having adequate chlorine dispensing of 50 ppm, which is the requirement, was also observed. And lastly, the hand sinks that were accessible. Some were used for storing dirty utensils and equipment, or they did not have hot and running cold water, or hot water, or individual paper towels. The chart below talks about the second auditable area. Of the 56 complaints, 53 establishments were identified. 3 were identified twice. And the take-home of this chart are the days between the complaints. The shortest time frame was only 42 days, but that's still over a month. So this references that there was not really a trend in either the food process or the food that was implicated in the complaint. That doesn't rule out employee practices or hygiene. Next slide. Now the third auditable area discussed the same establishment type. We see full service restaurants implicated in almost 50% of the complaints, with fast food restaurants at 20%. Sandwich and deli, which are like your Subways or your Jersey Mike's, were implicated in over 7% of the complaints. And then things like your Costco's and your Targets and your Walmarts with sit-down delis were implicated at 3.6%. We also had 10 establishments that were only implicated once, all with 1.8%. Next slide. So the fourth auditable area talked about the same food type. So this had to come directly from the consumer complaint. The consumer had to identify one food, and if they identified more than one food, the PHF food was identified as the food type implicated. If more than one PHF food was identified, then this complaint had to be identified as an unknown for that food type. So we had 15 unknowns, and as you can see, the next three were, as what we see in research and have seen for decades, PHF foods. We have chicken, hamburger, and steak beef as the top foods implicated. So the last auditable area, and the fifth, was the same food process. And this was a little more strict. This not only had to come from one of two areas. From the actual complaint from the consumer, they had to identify a process, whether steamed or handling or expired, that they observed, or the inspector had to find that same food implicated by the consumer and identify a process that was being violated during the inspection. So that resulted in an unknown of 70%. And then temperature abuse during holding and display of the food was identified at over 11%. The next slide I'm going to talk about includes the recommendations that I have for the project and some of the things that I've learned. So some of the inhibiting factors that I identified first during this data review was coding these complaints as either illnesses or outbreaks. None of the complaints happened from the same establishment or the same food type more than twice and from different households. Therefore, we had to identify each of the complaints as illnesses and not outbreaks. The next was a lack of consumer knowledge and disease etiology. So some of the consumers, a lot of them, identified being ill only moments of eating the food or even hours. So this was a lack of knowledge in the consumer of disease etiology and incubation times. The next was the time from when the consumer ate the food to when they filed the complaint. Some were almost months. That is almost impossible for inspectors to provide a trace back for the food establishment. We saw some of the same repeated risk factors, which brings upon the question, are our food handlers and our certified managers being trained properly? And what is the duration of that training? I think that it should be every 6 months for a food handler. Some cities have annually. Plano has every 2 years. I think that with that food handling being the top risk factor and cause of disease-borne illness, I think that that should be provided to food handlers required every 6 months. Then there are programs that are provided for establishments to maintain temperature control. HACCP is a great approach to maintain temperature control. I didn't see it much in the inspections that I shadowed. Actually saw it in 2 establishments, but it's a great tool to use to maintain temperature control. And then consumer education. This could be provided in a public forum, in discussion, lecture-based. It can be provided at community events, in booths, or just informational pamphlets. I think the health department should be provided the opportunity to give this information to consumers, should be funded in a way to do so. And then lastly, some of the accomplishments. I had a great time with the health department. It was eye-opening. I was able to put a lot of the books and the information I learned at Liberty over the last 2 years into application. It's different reading it and actually being there on site with the inspector identifying these food code violations. They were a great group. I learned a lot, and I've been very excited to have been afforded this opportunity. This last slide provides you an email address if you want to ask any questions about this brief or any information that I provided. Thank you for the opportunity.